Guyana has been operating in a pandemic since March this year, and just as citizens have had to adjust to new social and economic norms, so have organizations. The extent of the adjustment is vast, however. Today we will zoom in on how a little known but very active and effective department is operating during COVID-19. This department is the Rehabilitation Department located in the compound of the Palms Geriatric Home on Brick Dam, Georgetown. The Rehabilitation Department engages in occupational therapy. This is a practice of developing meaningful activities through which an individual can regain mobility of various parts of his or her body after being physically unable to carry out certain functionalities due to an illness or accident. Described as an allied health profession, occupational therapy is performed by trained occupational therapists and occupational therapy assistants. Up until 2018, Guyana did not have many trained personnel in this area. However, training is now being offered at the University of Guyana. We visited the rehab department during Occupational Therapy Month in October and quickly learned of some commendable changes made by the management in the best interest of their patients. These changes have been made to prevent the spread of COVID-19. While not all patients are elderly at the rehab department, many are, and in many cases have underlying health conditions, which put them in the category of persons most vulnerable for contracting COVID-19. The decision to close the doors of the facility came in September, but it has since been reopened with a schedule in place. But this was not enough for patients. So the team at the rehab department introduced telemedicine or telerehabilitation. But first, let's meet occupational therapist Calvin Laurie, who shares what his duties are at the department.
I'm currently stationed at the Palms Rehab Department, and I work with more neurological cases. A lot of the cases we see here would be stroke and spinal cord injury. So a lot of the times, occupational therapy is basically helping a person to regain their functions and their activities of daily living, which is things that they do on a daily basis, their occupations basically. It does not necessarily mean what they used to do in terms of job, but however they pass their time, if it's playing cards, it's cooking, cleaning the house. So I help them with specific activities to get them back to doing these things.
As we mentioned before, the large number of persons doing therapy at the rehab department have comorbidities, hence the introduction of telemedicine or telerehabilitation.
Well, our theme for this year is Reimagine Doing. The whole year is not what we expected. So we have to rethink how we go about treating patients, how patients would cope when they cannot come to the department. So we have to come up with ways and means of helping them to improve their function, whether we could see them in person or not. And the telemedicine is completely different from what we're accustomed to. So telemedicine or telerehabilitation, we would use technology to treat our patients. So whether it be a phone call, a text message, a video call, or sending our patients video footage of us doing these exercises so we could walk them through their exercise program without them physically being in the department.
We also had the opportunity to meet rehab assistants Melanie English and Grisella Bacchus. English is the rehab assistant attached to the National Insurance Scheme, NIS.
From the time the patient comes to me, I greet them, make them feel comfortable. This is the first thing because, some patients, they're very uncomfortable, they're very shy. Some of them, they haven't accepted what has happened to them. So the first thing you have to do is make them comfortable. So that's the first thing we do. We make the patient comfortable, and then we introduce the program to the patient. We get to know the patient more.
Bacchus, who has been a rehab assistant for about 13 years, says she is especially happy when her patients can begin to work more independently.
We usually work from the Palms, the Georgetown Hospital, and sometimes Talmareed Center. So we rotate, and now I'm 2 years at the Palms, working with stroke patients mostly. We do have some orthopedic patients as well. Being a rehab assistant, I do 3 disciplines: physical therapy, occupational therapy, and speech and language therapy.
Even as occupational therapy is still in its early stages in Ghana, there are a number of associations and groups, non-profit, government and non-governmental, working to ensure the growth of the profession. Here are a few among the growing list: Rehabilitation Services of the Ministry of Health, Palms Rehabilitation Services, Regional Special Education Needs Disability Diagnostic and Treatment Centre, the Talmareed Rehabilitation Centre, and the Ghana Association of Occupational Therapists. Occupational therapy has been around for more than 100 years. William Rush Dunton Jr., a psychiatrist and educator, is regarded as the father of the profession. It has its roots in the late 1800s when art and craft therapists began to work in hospitals using hands-on activities to engage patients with both mental and physical illnesses.